Have you ever ignored a symptom because you thought it was nothing serious? What if your body has been sending you warning signals that you should never ignore? A simple symptom today could sometimes be an early sign of a serious health problem tomorrow. From chest pain and breathing problems to sudden changes in your body, recognizing these signs early can make a life-changing difference. Today, we will explore 10 warning signs your body should never ignore and understand when it may be time to seek medical attention. Our body is constantly communicating with us. Every pain, change, or unusual symptom can be a message that something needs attention. Sometimes these signals are harmless and temporary, but in some situations, they may be early warnings of conditions that require medical attention. The biggest problem is that many people delay getting help because they hope the symptoms will disappear on their own. In this video, we will discuss important warning signs, what they could mean, and when you should consider seeking professional medical advice. Remember, having one of these symptoms does not always mean you have a serious condition. However, severe, unusual, or persistent symptoms should never be ignored. Chest pain is one of the most important warning signs your body can give you, and it should never be ignored. Many people assume chest discomfort is always caused by something minor, such as muscle strain or indigestion. While that can sometimes be true, chest pain may also be linked to serious heart-related problems. The heart is responsible for pumping blood throughout your entire body. When the heart does not receive enough oxygen-rich blood, it can create pressure, tightness, or pain in the chest area. Chest pain related to a serious heart problem may feel like pressure, squeezing, heaviness, or tightness in the chest. Some people describe it as feeling like something heavy is sitting on their chest. Sometimes the pain does not stay only in the chest. It may spread to the left arm, shoulder, neck, jaw, or back. Chest pain becomes even more concerning when it appears with other symptoms such as shortness of breath, sweating, nausea, dizziness, or unusual weakness. If chest pain is severe, sudden, or different from anything you have experienced before, it is important to seek emergency medical help immediately. Breathing is something we usually do without thinking, but when breathing suddenly becomes difficult, it can be a serious warning sign from your body. Shortness of breath can happen after intense physical activity, but sudden or unexplained breathing problems should never be ignored. Difficulty breathing may be connected to conditions affecting the lungs, such as asthma, infections, allergic reactions, or other respiratory problems. In some cases, breathing difficulty can also be related to heart problems, especially when it happens along with chest pain, dizziness, or extreme weakness. If you suddenly cannot breathe properly, your lips or face turn blue, or you feel confused or extremely weak, seek emergency medical care immediately. Headaches are very common, and most headaches are not a sign of something dangerous. Many people experience headaches because of stress, lack of sleep, dehydration, or other temporary causes. However, a sudden and extremely severe headache that feels completely different from your usual headaches should never be ignored. Some people describe this type of headache as the worst headache they have ever experienced. It may appear suddenly and reach intense pain within seconds or minutes. In certain situations, a sudden severe headache may be linked to serious conditions involving the brain, such as bleeding, stroke, or other neurological emergencies. A severe headache becomes more concerning if it happens with other symptoms like confusion, weakness on one side of the body, difficulty speaking, vision problems, seizures, or loss of consciousness. If a headache appears suddenly, feels unusually severe, or is accompanied by these warning signs, seek urgent medical attention. Losing weight through healthy eating and regular exercise is usually a positive change. But losing a significant amount of weight without trying can be a warning sign that your body needs attention. Unexplained weight loss means losing weight without making changes to your diet, exercise routine, or lifestyle. Sometimes this can happen because of increased stress, changes in metabolism, digestive problems, or other health conditions that affect how your body uses energy. While weight changes can have many causes, rapid or significant unexplained weight loss should be discussed with a healthcare professional. Pay attention if weight loss happens along with other symptoms, such as constant fatigue, loss of appetite, persistent pain, fever, or changes in digestion. Your body often gives early signals when something is changing internally. Recognizing these signals early can help you seek the right medical advice at the right time. Fever is one of the most common ways your body responds when it is fighting an infection. A mild fever can often be part of your immune system's natural defense. However, a high fever that continues for several days, keeps returning, or is accompanied by other concerning symptoms should not be ignored. When your body detects harmful viruses, bacteria, or other infections, your immune system increases body temperature to help fight against these threats. A fever becomes more concerning when it is very high, lasts longer than expected, or appears with symptoms such as severe weakness, confusion, difficulty breathing, dehydration, or severe pain. In children, elderly adults, and people with weakened immune systems, persistent fever may require extra attention because infections can become serious more quickly. Monitoring your temperature, staying hydrated, and paying attention to other symptoms can help you understand when medical advice may be needed. Seeing blood in your urine or stool can be alarming, and while it does not always mean something serious, it is a symptom that should never be ignored. Blood in urine, known as hematuria, can have different possible causes, including urinary tract problems, kidney issues, infections, or other medical conditions. Blood in stool may also have different causes, ranging from minor problems such as hemorrhoids to conditions that require further medical evaluation. The color, amount, and frequency of bleeding can provide important information, which is why discussing these changes with a healthcare professional is important. If bleeding is heavy, repeated, or happens with severe pain, weakness, dizziness, or unexplained weight changes, seek medical advice as soon as possible. Your body often reveals changes before a condition becomes serious. Paying attention to unusual signs can help you take action at the right time. Our vision allows us to understand and interact with the world around us. Because eyesight is connected to the brain, eyes, and nervous system, sudden changes in vision should never be ignored. A sudden change in vision can include blurred vision, seeing double, loss of vision in one or both eyes, flashing lights, or unusual dark spots appearing in your sight. Sometimes these changes may happen because of eye-related problems, but they can also be connected to conditions affecting the brain or blood flow. Sudden vision loss or major vision changes may sometimes be a warning sign of a serious emergency, especially when they happen suddenly. Vision changes become more concerning when they appear with symptoms like severe headache, confusion, dizziness, weakness, trouble speaking, or loss of balance. Regular eye checkups and paying attention to unusual changes can help protect your vision and overall health. Sudden numbness or weakness affecting one side of your body is a warning sign that should always be taken seriously. This may appear as weakness or numbness in the face, arm, or leg, especially when it happens suddenly. One of the most important causes doctors consider with these symptoms is a possible stroke, which occurs when blood flow to part of the brain is interrupted. A useful way to remember possible stroke warning signs is FAST: face drooping, arm weakness, speech difficulty, and time to seek emergency help. Other warning signs may include confusion, difficulty walking, severe dizziness, or sudden loss of coordination. If these symptoms appear suddenly, every second matters. Immediate medical attention can make a major difference in treatment outcomes. Feeling tired after a busy day or a lack of sleep is completely normal. Rest, proper nutrition, and relaxation usually help your body recover. However, constant or unexplained fatigue that continues for weeks and does not improve with proper rest may be a warning sign that something inside your body needs attention. Persistent fatigue is not just feeling sleepy. It can feel like a lack of energy, difficulty concentrating, reduced motivation, or feeling physically weak throughout the day. Many different factors can contribute to ongoing fatigue, including poor sleep, stress, nutritional deficiencies, infections, hormonal changes, or certain medical conditions. Fatigue becomes more concerning when it appears with other symptoms such as unexplained weight loss, persistent fever, chest discomfort, shortness of breath, or unusual weakness. If tiredness continues for a long time or starts affecting your daily life, it is important to discuss it with a healthcare professional. Fainting happens when a person temporarily loses consciousness because the brain does not receive enough blood flow for a short period of time. While some fainting episodes may have harmless causes, sudden or unexplained loss of consciousness should never be ignored. A person may faint because of dehydration, low blood sugar, stress, sudden changes in blood pressure, or other temporary triggers. However, fainting can sometimes be related to more serious problems involving the heart, brain, or nervous system. Seek medical attention if fainting happens repeatedly, occurs during exercise, happens without warning, or is accompanied by chest pain, irregular heartbeat, severe headache, confusion, or injury. Understanding these warning signs does not mean you should live in fear. It means you can become more aware of your body and make better decisions about your health. Your body is constantly sending signals, and paying attention to those signals can help you recognize problems early. From chest pain and breathing difficulties to vision changes and unexplained fatigue, these warning signs deserve attention when they appear suddenly, become severe, or continue over time. Remember, this information is for awareness and education only. Symptoms can have many different causes, and only a qualified healthcare professional can provide proper evaluation and diagnosis. If you found this video helpful, subscribe to NextGen Scholar for more educational content about health, science, and the human body. Stay informed, stay prepared, and take care of your health.